some babies, teething causes minor discomfort, but for others, it can be much more painful. In this video, I'm going to share with you all my top tips for teething. Hey, it's Morgan, and welcome to the Passable Parent channel. I've been a pediatric nurse for the past 10 years specializing in early childhood development, and I'm also a mom. Before we get started, don't forget to like, subscribe, so you don't miss out on any future videos. And if you have any questions for me, make sure to comment them down below. I love to hear from all of you. Thank you so much for your support. Your baby might be irritable, have swollen gums, sleeping problems, and difficulty eating. As a parent, I know how hard it can be when your baby is teething, and seeing them in pain is just awful. That's why I decided to make this video of teething hacks to help comfort your baby. With these tips and tricks, you can help soothe that baby and their sore gums, and maybe even catch some longer sleep stretches while you await that little tooth's first appearance. So, when do babies first start teething? There's a wide range of normal for when teething begins. Most babies start that teething process sometime between 4 and 7 months of age. The average time for babies to start teething is usually around 6 months old. Most often, babies get their lower center front teeth first. What are the symptoms of teething? It can be really tricky to figure out what's causing your baby's fussiness or discomfort. In some cases, we are quick to blame teething, when in reality, baby might just be learning a new skill, experiencing a developmental leap, or having a growth spurt. However, sometimes those new teeth are definitely the culprit. The most prominent signs of teething will occur usually 3 to 4 days before and after that tooth cuts through. Here are some signs of a teething baby: visible red or swollen gums, visible white bumps on the gum line, excessive drooling, excessive biting on objects and toys, ear rubbing or pulling, rash, redness, or chapped skin around the mouth, crying, irritability, interrupted sleep, and shorter naps. The good news is that the discomfort associated with teething usually only lasts a few days before and after the tooth erupts through the gum. The bad news is that your baby is going to get 20 teeth by their 3rd birthday. The sleep disruptions and fussiness can be frustrating and hard to watch. But with these tips, you'll be able to help your little one find some relief. So, here are my 10 hacks to help soothe and comfort your teething baby. My first tip for you is to offer a variety of teething toys. Offering a variety of teething toys is an effective way to help your baby find some relief from teething. When selecting teething toys, I always recommend choosing natural, non-toxic materials. This is important all the time, but especially for your teething baby who will constantly have these items in their mouth. You are going to want to avoid all of the following when purchasing teething toys for your baby, and I will link some baby-safe teething toys down in the description box below for you, so make sure to check them out if you're interested. The first thing you want to avoid when it comes to teethers is plastics. Teethers made of plastics may contain BAs, and other known endocrine disruptors and carcinogens. Even plastics labeled BPA-free may have other endocrine disruptors in the materials. You're also going to want to avoid liquid-filled teethers. Many teething toys that are filled with liquid for freezing or putting in the refrigerator have actually been recalled in recent years due to bursting. This may pose a safety risk, and I suggest avoiding them altogether. And the next thing you're going to want to avoid is vinyl. Teethers made from PVC or vinyl should be avoided. They can contain chlorine, other chemicals, and even heavy metals, so don't buy teethers made of these materials. The next type of teether you're going to want to avoid are painted teethers. Teethers that have paint or stain can chip off into your baby's mouth. The safer alternative is beeswax polishes or water and plant-based paint and pigments. So what materials are actually safest? Natural rubber, silicone, and washcloths are the best, safest choices for your baby's teething toys. Rubber, silicone, and washcloth teething toys can also be thrown into the freezer for some quick cold relief or even the refrigerator. Some of my favorite teething toys are Sylphie the Giraffe, the First Year's Massaging Action Teether, the Munchkin Meted Teethers, and I have a bunch of other favorite teethers which I'll link down below for you as well. My second tip for teething relief is to let your baby chew on silicone feeders or netter teethers. Products known as feeders are an effective way to give your baby some relief from painful gums. For the best pain relief, fill these feeders with frozen fruits, veggies, or purees. You can cut them up and put them in these nets so that way your baby doesn't choke on them. You can even fill them with frozen breast milk or formula for babies that aren't yet eating solids. Silicone feeders are a favorite in my house because even after the frozen filling is gone, it still seems to feel good on the gums. My third tip to help your teething baby is to give them a frozen washcloth to chew on. This is a teething hack that every mama needs to know. Take a clean baby washcloth, wet it, wring it out, and freeze it. You can even also put it in your refrigerator if you feel like it frozen is too cold on your baby's gums. Pull it out for a fun little teething relief activity that your little one will love. For added appeal, try knotting the washcloth or fabric before wetting and freezing it. My fourth tip for you is to offer cold or frozen foods. It's no secret that frozen and cold materials feel really good on a baby's painful gums. With that in mind, there are a few ways you can turn everyday foods into teething hacks to give your baby relief. Popsicles is one of them. Popsicle molds, especially ones designed for babies and toddlers, are a way to make a fun frozen treat for your little one. You can fill them with simple purees, smoothie mixtures, or even breast milk. Look for a mold that's made of silicone to reduce unnecessary exposure to toxins, like this one. This might get a little messy, and it's best for an older teething baby or toddler. Provide cold purees, smoothies, applesauce, and yogurts whenever possible. And my fifth tip is to massage your baby's gums. Massaging the gums can provide relief for your teething baby. All you need is a clean finger or knuckle to gently rub and press on the sore spots along your child's gum line. If you are breastfeeding, this works well before or after a nursing session, or midway through a nursing session if your baby tries to bite your nipple or clamp down on it, or your clothing or your body. You can do this exercise. Just gently rub their gums from side to side. My sixth tip for you is to massage your baby's cheeks and temples to provide teething pain relief. And I'll make sure to show you in the next clip how exactly you're going to do this. My seventh tip for you is to provide extra snuggles and attention when your baby is teething. They may seem inconsolable at times. Their sleep may be disrupted, and yours, and they may not want to eat or nurse as often as they normally do. Or maybe they want to eat and nurse more. Be sure to be extra attentive to your little one when they're teething. Offer them those extra snuggles and do what your little one needs to get some relief. Maybe napping in the baby carrier or next to mama, supervised of course, may be a good temporary measure while teething. My eighth tip for you is to take a damp washcloth, a baby toothbrush, or just a baby finger toothbrush moistened with just water and gently clean your baby's gums. This helps prepare them to get used to toothbrushing before their first tooth even emerges, and it can also help with that teething discomfort. You can start brushing your baby's teeth with a baby-safe toothpaste as soon as their first tooth emerges with a fluoride toothpaste for babies. I really like the Tom's of Maine brand of toothpaste, which I will link down in that description box below for you, but you only want the smallest amount of toothpaste on the toothbrush. Initially, we like to tell parents the size of a grain of rice or smaller. Dentists also recommend that you gently brush your baby's gums to prevent bacterial overgrowth. My ninth tip for you is that the American Academy of Pediatrics Dentistry recommends you take your baby to the dentist after your little one's first tooth appears and no later than their first birthday. During their first dentist visit, the dentist will make sure your baby has proper dental hygiene, and they will make sure that there are no issues with dental decay. And my 10th and final tip for you is that this time too shall pass. Take a deep breath. Try to just know that this moment in time is going to pass. Your baby will get through this. And just like everything else, when you have a new baby, a new child, things ebb and flow. So we tend to go through really tough times or, new developmental milestones and leaps, and it does disrupt babies' sleep. It can make them more fussy, and teething is one of those things, unfortunately. So just know that this time will pass. You will get through this. Soon enough, that baby is going to have a full set of beautiful smiling teeth that you will just love to see. I hope this video was helpful. Make sure to subscribe so you don't miss out on my future videos on all things child development, parenthood, and giving your baby the best start possible in life. And if you have any questions, make sure to comment them down below. Thank you so much for your support today. Make sure to subscribe, and I can't wait to see you in the next video.